So, hi everyone. First of all, I hope I'm audible and visible to you all. Please send your thumbs up if I'm audible and visible to all of you. Great. So, before starting, we have our co-founders there, and I would like to welcome them. So, we have Sagar sir and Asta ma'am. So, it's all because of them that we all are here today. So, a big thanks to them for this. And now let's start. So, my name is Dr. Sukhanpuneet, and I'm currently doing my MD radiology. And just a quick introduction of what I have gone through, just to tell you that it's all possible. If I could have done from this to doing MD radio, I think it's possible for all of you. So I started with Initiate May 2022, not being qualified, to NEET PG 2022, rank of 80K. And then coming on to Initiate May 2024, I got a rank of 21K. And within in 1 month, I jumped to 3000, a rank of 3000. So if I could do it in 3 months, I think all of you can do it. And it's not about your capabilities. I think it's more in your mind. What you can do, what you tell your mind, your brain works like that. It's for example, a very small example. If I tell you to think about, do not think about elephant. I think all of you will be thinking about an elephant right now. So that's a brain. It does not know the meaning of no. It will do everything that you tell your brain to do. But no does not exist. So there is no negative thing that exists in a brain. If you tell your brain that I can study for 18 hours, it will do. So it's all in your mindset that changes. For example, a friend of mine had, written on a paper that she'll get a rank of 832. And in the exam, she got a rank of 862. So it was a random thought that she just put on wall and it came true. So it's all in the mindset, because once you have a goal target set, I think you work towards it. So let's start now. Strategy. I think we have 4 to 5 months ahead, and you all can do great. I think wonders can be done in 5 months, given you do it in the right way, with the right strategy, and most importantly, with the right guidance. See, you people might think that guidance is something that's very common, but I think it is very personalized. If you go to watch any random YouTube videos, you will find people telling you things. But there are so many hidden things that nobody tells you, because at the end of the day, competition does exist even when you're on the other side. Because nobody wants you to see that successful as they are today, right? So for that, you need your personalized guidance, and personalized guidance can only be done when somebody's with you throughout the journey. So the guidance is that important. Now, see, content is no more a game changer, because everybody is doing BTR, everybody is doing RR, and everybody is doing Preeti ma'am. So, what is going to change? Everybody is going to read those same notes and go to exam. Then, why is not everybody getting the same rank? Because content is not deciding what you get. Your rank will be decided by the number of questions you do, the way you read your content, and where you plan your day. It's all in the way you solve the question rather than what you read, because everybody is reading the same content. See, BTR will get you, BTR or RR or any content that you do will get you a total of 120 to 130 correct. But from 130 to a journey of 160, that decides your rank, that decides your branch, that decides your college, is all your strategy. And that comes from the question. The way you do question, the way you revise your things. You can do a very limited content and get a great rank, and you can do just mean videos and will get nothing. So it's not with the content. I mean, content is not the limit. Like the sky is not the limit, same as the case with content. See, you can go for Love and Bailey for surgery, but then there is no guarantee that you will get all correct in surgery, because see, there is a lot of content, but you need to consolidate that information and put it in your head, so that when the question come, you know that how it is to be applied. And when the exam is in the MCQ mode, you cannot, decide, you cannot do it if you have not practiced your MCQ skills well. So for you to do well, I think the MCQ is the game changer and not the content. The more content you do, I believe there is less probability of you getting a good rank. So please limit your content, concise your content. One. Secondly, you need to plan your day. If you haven't planned your day the day before you sleep, you cannot work the next day. For you to give 100% the next day, you need to plan your day. Secondly, you need to plan your hours. Before hours, please plan your slots, then your hours, and then each and every hour, and then your minutes. Right? Now, most of you are very, very worried about your GTs. Please do not take GTs as your testing tool. They are your learning tool. We'll
तो
discuss in detail
वेबिनार
that
चल
how
रहा है?
you need to go about GTs. But learn one thing, that the more you fear from GTs today, the
अभी
more
तुरंत ये
you will
मिट्ठू को
fear
फॉलो कर
from your
देगी।
rank after your result. Right? So the worse it will be. Better you do now, easier for you it will be in the exam. The more you practice an exam, the easier it is on the day of exam, right? Second, third, everybody think that you have done your PYQs and it's done. No, PYQs, everybody is doing PYQs. And see, NEET PG is an exam that asks a lot of width and not the depth. With width, I mean lot of information, lot of topics, but those topics are not in detail. And PYQs, I just tell you that this is an important topic. And NEET PG does not repeat the question. INA does, but not NEET PG. So everybody is doing PYQs. That has become part of syllabus now. Please do not feel that I have done all correct in PYQs and I'm good to go. No, there is lot more to be done yet. Okay. So what is that lot more that you need to do is your PYQs. See, I'll answer all your questions once the session is over because then it breaks my flow of content. So please hold on to your questions, and once the session is over, we'll discuss the questions in detail. Okay. So what is the real game changer? These are your MCQs. And how you need to do MCQs and how many number of questions you need to do, we'll discuss in detail. So PYQs is not the number of MCQs. When we'll talk about doing MCQ, you will not consider that as PYQs. Okay. And last but most important, trust yourself. This journey, nobody can understand what you're going through more than you yourself. I think it's a very painful process, and I completely understand it. You are alone with yourself, just in your room. If your parents are non-medicals, they understand that it's a tough phase, but they do not understand what all you are going through. I mean, the GT scores fluctuate. Everything is a mess, and you do not even know that is it your right strategy or not. But one thing you got to tell yourself is that whatever I'm doing is right. See, if you do not tell yourself that you are doing right, nobody's going to believe in you. So for others to believe in you, the first stage is believing in yourself. Because otherwise, there will be a lot of FOMO of doing things. Am I doing it right? Have I enough content? So please believe yourself in this journey, and you're good to go. Now, most importantly, timetable. So we had already a session last month, and we discussed that first cycle is from 20th November to 31st Jan. And I believe, and the timetable in detail is discussed in the pictures. I'll send you it afterwards. And I believe most of you are at the end of the first cycle, which was a detailed cycle, and the dates are similar to what Zena ma'am has told, because I believe everybody is doing BTR, so it's just more easier for me and you as well. And now another cycle ma'am had given, which was extending till March. So I have tweaked this timetable a little, and we are doing like two cycles in that one cycle which ma'am has given. So we'll be starting another cycle from 1st of Feb, which will extend till 31st March, and we'll be completing the entire syllabus till 31st of March. And I've given a shorter timetable for students who think that they just need 1 month, and for that 1st Feb to 28th Feb. That's discussed in detail in the picture, in the screenshot pasted, and it starts from 1st Feb with number of days given as well. See, if you are good to go and have done 2 revisions, I think this timetable is a must. And what we do is in our community channel also, we put targets every day, and we tell you that this is how it has to be done. Every subject is discussed in detail, that this is how this subject has to be approached, and then accountability is kept on you, right? So this second cycle is from 1st Feb to 31st March for all of you. You need to, if you are making your own timetable, nothing like that. I think that's the best way to go. Then please use these 2 months so that you have another cycle from 1st of April to 30th of April. And by this time, you are done with 3 revisions, right? And if the exam, any set is in May, you are good to go. Now, how to plan your timetable? See, for the first timetable, we have like you should all try to do 4 to 5 revisions, because I believe there are people who do well in first cycle as well, but people like me who need to put in a lot of efforts, and people like all of us need multiple cycles. For that, I think minimum of 4 is a must. But now every cycle cannot be same. If you are reading a things every time in the same fashion and manner, I think it will not fetch your rank. For you to get a better rank, every time you read something, it has to be differently read, so that you read in between the lines. For you to learn how to read in between the lines, every time that has to be read differently. How? For example, in the first cycle, you are doing a subject. Now that cycle has to be done very thoroughly, and you need to follow both your RR notes for that and BTR for that. See, I am a big believer in doing no main notes because I believe it's a lot of wastage of time and you are not able to retain much. Please stick to RR and they are good enough. For some subjects, you don't even need RR. Even concise notes like BTR is a very good source. No paid promotion and we are not getting anything in that, but it's a genuine experience that I'm telling you, that BTR is great for short subjects like for skin, anesthesia, psychiatry, radio, ortho. Just stick to it and you don't need anything else, right? One subject that needs main notes is pharma. If you're doing pharma from GRG, sir, please do main notes because pharma forms the backbone of each and every subject. You will get questions related to pharmacology from microbiology to medicine to surgery, and you cannot find a shortcut in that. Please stick to pharma for main notes, and we'll discuss in detail how to do pharma in the subsequent video. Also, every morning you need to do two set of custom module, one in the morning and one in the night. In the morning, you will do all tags, 50 questions with all subjects. Now you will have to select all tags and all subject, and that custom module has to be a 50 question. Now how to approach in that and how to review, we'll discuss in detail. Also, GT frequency in the first cycle can be for 15 days each or 10 days each. That is very subjective depending upon how you are comfortable. But for first 1 month, I would request that you stick to 15 months, 50 after 15 days, right? And then you'll slowly move to 10 days after 10 days. In the second cycle, please, when you start reading, do not read what's written. First, open the page and think in your mind that what all you remember. Now, in that way, you will try to do active recall, and that active recall will actually help you in memorizing and retaining things. Otherwise, if you just open your notes and start reading, you will not be able to retain things and you will be just doing a monotonous read like you had done the previous time. Now, what you need to increase is number of questions in the second cycle. Now, please, after you're done with every subject, a TND or a SWT, that's a subject-wise test, is a must. And that is a check or a closure whether you know the subject or you don't know the subject. For you to have a closure, please try to score more than 35 correct out of 50 in each SWT. And if you have an app that provides with the video solution, please go for it, because that polishes your concept like nothing like that does. Also, custom module, like you're doing 50 questions in the morning, and if you're doing good and you're improving and your score is more than 30 correct, I would suggest that please start with doing 100 questions. Okay. At the night, the custom module has to be of the subject of the day. In the morning, you were doing custom module of all subjects. Now that serves as a revision, but you also need to practice question of the subject that you're doing. And you cannot go to QBank because QBank provides you with a variety of questions, and some of the questions are not even important and they're just doing it because they have given it in main notes. When you do it as custom module, they provide you only high yield topics, right? So that it is filtered for you. So please do questions of the subjects that you're doing on the day at night, 50 questions, but remember that you have to do all tags. See, if you are selecting PYQ just as your tag, then you're just repeating PYQ questions and then you're not learning the art of doing MCQ, right? In the second cycle, please increase your GT frequency. Do it every 7 days or every 10 days. And try to do retrograde approach. Now, what do you mean by retrograde approach? For example, you know a subject really well and you've done it multiple number of times. And every time you open your notes, you're doing mistake in the same topic. Now, do not read that topic first. Open a custom module, select that topic and select 50 questions of that topic and do all the questions. Now go retrogradely. Whatever is wrong in that topic, open that page and read that topic. Your one topic is done, and the depth of information of the concept that you'll have now will be much more than reading it anti-grade wise, right? So this way, 50 questions, 50 topics. Do 50 questions first and then 50 topics will be revised retrogradely. In third cycle, it has to be entirely retrograde. You start with 100 questions of a subject, you do 100 topics. You do another 100 questions of a topic, you do the another 100 topics. This way, you will be done with your entire Q bank indirectly and also your subject without you knowing. See, if you're doing 100 questions of a subject every day and you've given 3 days to it, you're doing 300 questions of that subject. And without you knowing it, you are already done with 300 questions. Hai na? And that's almost a Q bank, right? Also, please use third cycle as more of testing tool to learn rather than reading your content, because I think once you're done with reading twice or thrice, you tend to find it monotonous and you read the lines that you know and you don't read the line that you don't know, and you're following that cycle again and again. So please start doing more tests so that it tests your knowledge, and that is how you will improve. Okay, the third cycle is the cycle where you will use your 20th copy. Now see, SWTs are must for every cycle. In 20th copy, what you're going to write is your volatile topics. Now I was one like who could not make a 20th copy, but what I did, BTR has choti copy videos. Now watch that choti copy videos. They are the most volatile topics given. That is your what you say blueprint for a choti copy. Now build that choti copy on your own. Once that choti copy is done, write down all the topics that you find volatile, and that will be your most high yield volatile choti copy, right? Because see, at the end you need to revise everything in the last day, and that's what I did. For you to revise everything in the last day, you need to have a choti copy, and do not start it before the third cycle, because then you end up writing everything in that choti copy, and that's no more a choti copy. In the fourth cycle, what you'll start with is you'll give one GT. You'll see what are your bottom three subjects. You will revise those bottom three subjects and then give a GT. Another three set of subjects will come in the bottom three. Now you will revise those three subjects, right? So we have total of 19 subjects, है ना? You will give 7 GTs and you will revise all the 19 subjects. I think that works wonderfully for everybody, है ना? Of us, me and my friends, and that will work great for you as well. Because every time you revise a subject, do it differently. The more you do it differently, the better you'll get your rank. And fifth cycle is a quick revision of your choti copy, of the notes that you remember, or of your volatile topics. Now, MCQ solving skill, the real game changer. See, if you work on your MCQ skills, I think content is lower than MCQ solving skill. Content can get you marks to a certain extent, but nothing like MCQ. For example, in my NEET PG, we had a question that in which of the following box-like appearance is seen, and we had options like lichen planus, psoriasis, morphea, and everything. Now, I was sure that other three are not the answer. So I marked morphea confidently, and that was the answer. So if you work on your ruling out skill, I think you can get marks. Like this NEET PG was not about how much you have learned, but how well you have learned and how much you know in depth. And that can only be worked if you rule out options. For example, you're doing one topic and you're ruling out other three options. You are indirectly doing 4 topics, because you're not jumping to the answer, but you're coming to the answer after ruling out other 3 options. And you can rule out only once you know the topic in depth. So whenever you are doing a SWT or a custom module, please rule out 3 options and then come to the answer. That way you will be passively revising other 3 topics without you opening your notes. See, you need to realize that NEET PG is not about opening notes and then revising. You have to do your revision within in a revision. And that can only be done if you find tips and tricks. For example, you are doing a question and you see the options. You should think about that topic in your head, that this is not the answer because it has this. And there and then the keywords of that topic are done. So first is ruling out options. No matter how easy the question is, you will not jump to the answer. No matter what is happening in the world, you will rule out option and then come to the answer. Make a promise to yourself here and now that you will only rule out option and then come to the answer. And if you practice this thing for next 5 months, nobody can stop you from getting a rank. Next, number of questions to be done. You need to do 50 questions in the morning of all subject, as I told you. 50 questions at night before sleeping of the subject you are doing with all tags. Nobody is going to use tag of PYQ, just only PYQs. That is not going to help and not going to get you a rank. Please select all tags and do. You are being biased in the very first stage of your preparation if you are using all only PYQs as your tags. Okay. Now, what to annotate? See, if you keep annotating everything, at the end, your BTR will not be a concise source and you will end up writing everything on it and you will revise nothing. For you to annotate, you need to be very smart. See, first thing, if a question is correct by more than 40% of the people, only then you will review that question. If that question is correct by less than 40% of the people, please ignore that question and move, because there is a lot of information that Marrow is asking that is not going to come. They'll ask you updates that has happened the previous day. It's like that. They're that quick in asking questions and going in lot of detail, right? So first criteria is 40%. Secondly, now see whether that question is a recall error, conceptual error, or new information. If it's a new information and correct by more than 40% of the people, that means you need to know, and that content will go in your book. Secondly, if it's a recall error, open your notes. Whatever is a recall error, just write R on it, so that when next time you are reading your notes, you know that this is your volatile topic and you read it well and you pay attention to that particular line, because it is volatile for you because you tend to miss that line. Just write R or put a star on it and you're good to go. Now, if it's a conceptual error, there are two ways to approach that question. There is MCQ ID of every MCQ given at the bottom of that MCQ. है ना? Write that MCQ ID. Every time you're reading that concept, open the MCQ ID. Now you'll read that explanation again, and that will work. Your brain will remember that, okay, I read it. Now you will do it twice or thrice. The third time you open the MCQ ID, you are already so well versed with that MCQ and the information that you don't need to read it now. So just erase that MCQ ID, and you are not annotating anything, but you were indirectly annotating things, and you're sorted with it. Secondly, if it's a conceptual error and you want to annotate, please annotate it as flowchart or as a mind map. If you write everything in lines, you will not remember it, because that's a concept and you already don't know it. For you to learn a concept, it can only be learned if you write it in a form of flowchart, a table, or a mind map. See, if you explain someone something, it stays in your mind, because then you have concise that information, right? Similar goes for the concept. For you to master a concept, please make flowcharts and timetable. I mean, mind maps. Bookmarking the question. Again, bookmark only those things that are your conceptual error or a new information. If you do not want to annotate, please do not bookmark your recall errors, because then you're bookmarking a lot of question and you will not revise any of these. Okay. When to revise them again? Whenever you are revising that topic, please go to your bookmark question, and you should be so well versed that this is what I bookmarked. Okay. How to plan your day? See, you need to plan your day a day the previous day, so that your next day works well. For you to do that, you need to plan your slots. For you to plan your slots, you need to plan your hours, and then how that is how you will work productively in a day. Your exam is of 3.5 hours, so you cannot make a slot less than 3.5 hours, because if you do not have the habit of sitting for 3.5 hours here at your home, you cannot stick there and sit, and your brain will not work. Okay. So your slot will not be of less than 3.5 hours. Now, if you work maths and you do 12 hours study, you can do 4 slots in a day. And the last slot can be of 3 hours, because yes, our brain gets fatigued and it's difficult, and that's normal, right? Now, how to start your day? Your day will start with MCQ as discussed again previously. 50 question, all tags, all subjects. You will study pharma every day from tomorrow till the last day of your exam. Make this as a promise that no matter what is happening in the world, no matter who is saying what, no matter what catastrophe has occurred, pharma has to be read every day from tomorrow till the last day of your exam. Okay. Now give 1 hour to pharma every day and keep revising it every day. This way you will revise pharma 9 to 10 times, and that is what I did. And this way my pharma was on my tips. Then do your subject of the day followed by a SPM. Now see SPM. SPM and pharma are some two subjects that are very volatile and very scoring if you know them. The way you are giving 1 hour to pharma in the morning, please give 1 hour to SPM at night, right? How it has to be done? There are various quiz channels of SPM in the Telegram. One is Kashish sir and second is Neha ma'am. Follow whichever teacher you want, but I'm a big fan of Kashish sir because he solves all the controversies and you can blindly trust that man for any kind of controversy in SPM, which there tend to be lot many. Okay, now the quiz that happens is every day at 9:30 p.m. What you will do is you will revise your SPM from 8:30 to 9:30. You will do that topic and the topic is already told to you. You will solve the PYQs of that particular topic and attend the quiz. This way your cycle of quizzes will repeat and you will do SPM 4 to 5 times by just giving 1 hour every day. And I think that works like amazingly. And you will find SPM as a short subject. For example, I was able to revise my SPM in 2 hours at the end because I had revised it multiple times, right? Followed by you will do questions of the subject you are doing every day. Now see, you have breaks. For you to do better than your peers, you need to be very smart in utilizing your breaks. What you can do in your breaks? In your lunch break, please do one mini test. The mini test is just 20 questions, can be solved in 10 minutes. I think our breaks tends to go very long. A 30-minute break goes to 1 hour and 1 hour break tends to stretch to 2 hours. And we can fetch 10 minutes for ourselves in that break where we are productive. Now, Marrow has amazing mini test. And the mini test is on a particular topic, 20 questions and that topic is done, and then you don't need to refer your notes for that topic. So in your lunch break, one mini test followed by reviewing that mini test in that break itself or in your dinner break, right? Compiled module, for example, there is a day you are not doing well and you are taking a lot of breaks. The compiled modules in BTR are amazing and they integrate all your subjects together. So please watch compiled modules, or you can give 1 hour every day in your break to your compiled module. There are choti copy videos of 15 minutes each. When you are tending to have a long break and you're not able to come back to your study, please watch choti copy videos. See, there will be days where you will not feel like studying. For those days, do not try to do passive read. Do not try to do active reading. Rather, watch a video because when somebody is teaching you, it's easy. So watch a video and then the momentum will come back. Because there are days you are sitting with your book but nothing is going in your head. For those days, watch videos. Watch a video which is not of the subject you are doing. Because I think the saturation comes at a point. For you to break that saturation and monotony, you need to watch something that's different. So watch a choti copy video or watch a compiled module or something that's interesting, something that integrates subjects and that works well for our brain. And if nothing is working, just take a page, sit down, and whatever you revised or done, please please do a mind map. Like we have a Telegram channel where we do mind maps every day. We tell a topic to the student, and then he or she puts that mind map, and that's part of our community channel. So mind map is something that works great. So one child is doing it every day, and all of you are revising it. So mind map is one thing that you need to do in breaks. Now, how to stay consistent? Now, it's a very, very long journey, and we tend to lose track of the path that we're following. And then there comes a point we start judging ourselves. For that, you need to do a revision within a revision. What do I mean with that? Whatever you have done in the previous day, you need to take 1 hour or 30 minutes and revise that entire topic. Now, that topic cannot be revised in 30 minutes. One day cannot be revised in 30 minutes. But if you make a mind map of everything that you've done in the previous day, I think that then you are so well with the concept of the previous day that you don't even need your notes for the next time. Also, um, please try to read. You cannot do everything that you've done in the previous cycle in the next cycle. So for you to do not have the FOMO of what you have done in the previous cycle, please do mind maps again. Okay. Secondly, active recall. Now, how you do active recall? For example, you're going to start with surgery. Just open one page, first page of your surgery notes, है ना? Now think everything that you remember that you have done previously, and now read that page. Now, when you have that lacunae in your concepts, you will read them well. So please try to read those lacunae, and you can only find those lacunae when you do active recall. अगर याद ही नहीं करोगे मुझे क्या याद है, तो आपको पता ही कैसे होगा मुझे क्या पढ़ना है? For you to know कि मुझे क्या पढ़ना है, दिमाग पे स्ट्रेस तो डालो. See, your muscles, all of you are gym, most of you are gym freaks, right? Muscles तभी बनते हैं ना when you work hard on that muscles. The same goes for brain. अगर दिमाग पे जोर डालोगे तभी तो उसको काम करने की आदत पड़ेगी. अगर आप आराम से बैठे हो, you think that you will everything will go in ahead, ऐसा नहीं होगा. जिम पे भी you are not sitting with a dumbbell and it's working. No, you have to push your limits. Same goes for brain. But what the thing is, we all fear. हम डरते हैं अपने दिमाग पे जोर डालने से. We are fearful that अगर हमने सोचा I will not remember anything and I will have a BT. Then what? अगर आज BT होगा तो एग्जाम अच्छा होगा ना. अगर अब BT नहीं लोगे तो रिजल्ट के बाद BT आएगा. Try to be very practical in life, right? So BT और GT से डरो मत. Give it now and you'll get a better rank, right? Also, you need an accountability. I think accountability is the most important thing in this preparation. If you have a study partner, nothing like that. If your parents are checking on you, great. If you're doing it yourself, great. But then if nothing is working for you, I think we guys are there for you. We have a community channel. We have a long mentorship. In that community channel, you are supposed to put your target early in the morning, and then you are supposed to text us back that this is what we have done, along with number of hours you're putting. Okay. And same goes for guidance. Please seek help. There is no shame in asking someone that I am not able to do well, please help me. The thing is, we all have been toppers throughout our life. And when we come to a stage where we do not know what is happening and how we need to go about, most of us do not ask thinking wo kya sochenge and they will judge me. Then what? See, when it's your life, when it's about your career, do everything that you can do to make a successful career, right? There's nothing big. मतलब अपनी life और अपने career से भी ऊपर तो कुछ है ही नहीं ना. Whatever you'll do in this 1 year will decide your next 40 years. For that, ask anyone. अपने senior से पूछो. अपने किसी ने अच्छा rank लिया है, go out and ask for help. And if nothing, then please come to us, because we are all there for you 24/7. No matter how busy our residency is, no matter what we are doing, we'll be there and we'll keep accountability check on all of you. Now, how to do spaced revision? So now, as discussed before, you will spare every day 1 hour for everything that's done in the previous day. See, passive revision will not help you. Reading your notes again and again will not help you. So what is the game changer? As discussed, it is the active recall. Now try to integrate stuff. For example, you are doing upper limb from your anatomy today. Please open your ortho notes and read upper limb there and then. Read nerve injuries there and then. Now you have done upper limb from anat, ortho, nerve injuries. Everything is integrated, and I think it is only then that you will be able to solve an MCQ. Because the pattern of the exam is changing. It's an integrated approach. If you do not know all of these three things in one go, in the vertical approach, you will not be able to solve the question. For you to know something and solve, अगर अब practice करोगे तभी तो कर पाओगे ना. I know ऐसे होता है कि नहीं अभी नहीं करेंगे, बाद में कर लेंगे, अभी डर लग रहा है. Please open your notes there and then. There are times you feel नहीं अभी मुझे target complete करना है, फिर मैं देखूंगा. बट टारगेट किसके लिए इंप्रूव करना है, कंप्लीट करना है? टारगेट तो एग्जाम के लिए कर रही हो ना. तो बेटर ऐसे इंटीग्रेटेड अप्रोच में करो. बीटीआर इज वेरी इंटीग्रेटेड, बट सब्जेक्ट्स तो अलग अलग ही है ना. उसके लिए तो खुद ही एफर्ट्स डालने पड़ेंगे ना. सो व्हेन यू आर डूइंग समथिंग फ्रॉम वन सोर्स, please try to read other topics of the same content, of the same topic from other subjects as well. Okay. Find all quiz channels and do a lot of quizzes. Now, please do not find every channel that gives you a quiz and start doing quiz. Then you will not be able to solve any of these. Find 2 or 3 authentic channels. For example, there is one for SPM, there is one for OBGY by Deepti ma'am, and I think that's more than enough. And yes, Preeti ma'am. nothing like her. So find 2 to 3 channels and stick to those channels and solve MCQ. Now I find people texting me, ma'am, tell me all the channels that have quizzes. फिर तो Marrow पूरा पढ़ा है ना. Marrow has I don't know how many questions. Then you can solve all those questions, but you do not have the time to do that, and that is not even fruitful. Even if you have the time, but that is not fruitful, right? And then best way to integrate things is like my favorite mini test. So when I had a rank of 21K in May INI 2024, what I did is I did 18,000 questions. Thank you for your information. So so what I did in that 1 month was I did all the questions of mini test. I started mini test from 2024 and I did mini test till 2017. And I don't know how many questions they were, and I was so well versed with every question, and my MCQ skills improved because those mini tests are really integrated and they test your knowledge till the deep core. So please do mini test. GT scores. See, GT scores is that gives us a lot of BT, but that's okay. If they do not give you BT here, you will have a very big BT in your final result. That's okay because उसी BT से आप पढ़ोगे, ठीक है? So GT scores keep fluctuating, and that is very common. If you are getting 130 correct today, you might get 115 correct in your next cycle, and that's okay. See, constant नहीं रहना चाहिए. Constant तो कुछ होता ही नहीं है. Either you go up or you go down. There will be phases जब score नीचे जाएगा. That is very common because there will be GTs that are difficult. For example, today you did a GT that's easy, but tomorrow you have a GT that is asking you more difficult question. So you will have +-5, and that is okay. See, +-5 चलता है. You cannot have +-20 scores. So please take an average of +-5 to 10 correct and incorrect question. That's okay. If it's more than that, then that's alarming. Okay. You need to have an upward graph, but that upward graph cannot be a straight line. There will be dips in that graph, and then there will be rises, and that's okay. That's how life is. You have a dip and then you rise above. If you do not have a dips, you will never know what are your weak points, and then you cannot rise. अगर life इतनी smoothly ऊपर चढ़ जाती तो there would have been no struggles, and then there would have been no difficulties. But those dips are important to teach you that these are your weak areas and weak topics that you need to revise, right? Do not take your score as your final verdict. For example, my maximum score in a GT was 150 correct. But in my exam, I had a score of 160 correct, and I never got 160 correct in any of the GTs. So you never know how you perform in that exam till the very last day of your exam. There were people who were getting 170 correct, and they got 140 correct in the final exam. Your preparation lies till the last day of the exam. On your day of exam, it's how you maintain your calm, how you well read your questions. Your knowledge is till the last day of your exam. But on the day of your exam, knowledge is one part. But there are a lot of other things that matter. So please do not take GTs as your final verdict. Even if you're getting 170 correct right now, that's great. But do not be overconfident. And if you're getting less than 120 correct right now, that's okay. You will improve. There is a lot of scope. You are just in the starting, and you have 5 more months to go. Even in January, I was getting 123 correct. So if I can be on this side, I think all of you can be on this side as well. Okay. GT copy. Now, I think the more number of copies you make, the less you study. So please stick to one copy. Instead, review the GT there and then on the day of the day you have given the GT, and move to next. Now, how to review the GT? Please give 5 to 10 minutes to each question. If you are revising that question, please give 5 minutes, maximum of 7 minutes. I think that is enough, and that maths work for everyone. Now, do not open your notes unless or until it's a conceptual error or a new information. If it's a recall error, just read the question, read the explanation, and move to next. What happens is when you open your GT, when we give a GT, once we start reviewing, we are in that mode. हम तो सब करेंगे आज. मैं नोट्स भी पढ़ूंगी, मैं जीटी की रिव्यू भी करूंगी, मैं सारा कुछ कर लूंगी. But at the end, you end up doing nothing. So first, you will start with your incorrect question. Now, in that incorrect question, also start with the subject you have done, and then move to the subjects that you have not done. But you will still review the questions of the subjects that you have not done. So that आज आप उसको पढ़ लो कि ये एक सब्जेक्ट मैंने नहीं किया, but ठीक है, उसका क्वेश्चन पढ़ लो. Now, next time when you read that topic, you know ki, acha, this was something that was important and I need to pay attention. So it's a stimulation for you so that next time you know that when you read that chapter, you know it's important, right? Once you have reviewed your incorrect question, move to the question that you have not attempted, and then move to the question that you have done right, but they were your guest questions. See, guest question आज ठीक हो गया क्योंकि luck काम कर गया, but हर बार वो luck काम नहीं करेगा. You need to revise those questions which were guest marked. So please use that option of guest mark and tick that whenever you are doing a guest work. So that this time it's a guess, but in the exam, you know that, yeah, my question is right. Okay. Again, the 20th notebook, please make it in. I don't think you need one. I think the choti copy videos are a great source, and you keep adding on to that itself. So this is my GT score. See, it had a lot of fluctuation, lot of dips and rises, and then I was just at 67 percentile, 70 percentile till the very end. Till see July, it was in yeah, it was in Jan that I started going to the 95 percentile. So it took me a lot of times. For example, my score of 112 correct was stuck for almost 4 months. It took me 4 months to come to a score of 130 correct. So there, I know for some people it works like I mean amazingly and it's done and you are at a very good score in your 2 months. But for people like me, it doesn't. It takes a lot of time and that's okay. It's a marathon. It's not a journey that is for one day or 1 hour. It's a long journey of 12 months. For somebody, it will happen in 2 months. For somebody, it will take 6 months. And for somebody, it is just one day before the exam that you feel that, okay, it's me on the right track right now. Right. So please do not judge anybody else for of their journey. You don't know what they are facing. Maybe they're getting correct, they're getting a very good score, but maybe they're facing a lot of other things. So it's your journey. And do not ask your friends what they are getting because there are two things. If you are getting more than them, you'll be very confident and overconfidence will come. Acha, mera to acha hi aa raha hai. And then you will have a dip. And if you are getting less than your friend, I think then you will be like, मैं क्यों नहीं कर पा रहा? A lot of factors, self doubts will come. See, Marrow gives you your state rank, your all India rank. इट्स अ सिंपल गेम दैट आपको पता है इंडिया में मेरे से इतने लोग आगे हैं और स्टेट में मेरे से इतने लोग आगे हैं. इससे ज्यादा तो आपको चाहिए भी नहीं ना. उसमें से आपका एक फ्रेंड आपसे आगे है, आपसे पीछे है. हाउ डज दैट मैटर्स? अगर एक आगे है तो बाकी 10,000 भी तो आगे है ना. Try to beat all those 10,000 and not just your friend. So please make it your personalized journey. Your competition should be you yourself and not those one or two friends, right? Your competition should be to beat everybody who is ahead of you. For example, in my May I had a bad rank and all my friends had a good rank. I made a copy and wrote the names of all of them who got a good rank, and I made sure that I cut their ranks and I am getting a better rank than them. So it was not just one person, but everybody who was getting a better rank. And then in my exam, I had a better rank than all of them. So please set your bars high. If your bar is just beating one friend of yours, you will not get a good rank. You are giving an exam that is of India level, right? It's a pan India exam. So make sure that your target is all India rank 1 and not just a rank better than your friend. Now this is my GT score and it took me a lot of time to reach to come to a score of 151, as I told you before. So please have faith on yourself. I think the biggest thing that works in this exam is faith in yourself and right guidance. If you have right guidance, I have a student with me with long mentorship, and that child was had a rank of 42K in the NEET PG, and I think in just 3 months she has come to a rank of 200. So it's all because we have been through a journey and we know that, yeah, this is what needs to be done and this is what is not need to be done. See, everybody tells you kya karna hai, but nobody tells you kya nahi karna. And I think that is more important because then you don't tend to waste time जो नहीं करना है ना. Most of the time तो हमारा यही निकल जाता है कि अच्छा ऐसे नहीं पढ़ना था. And when we are close to the exam, we realize कि oh shit, अगर मेरे पास और टाइम होता अब मुझे पता है कैसे पढ़ना है. तो उसके लिए you please seek help if you can. So accountability. Please make a to-do list. Like students send me their to-do list in the morning. If you have a Diary, please write your to-do list and stick that in the visible area of your room, so that any time of the day you don't feel like studying, you know that there are a lot of targets and you need to complete them. Okay, now give time to each topic that you do. Please give 7 minutes to every page and set your timer, so that you know कि ये पेज को मैंने 7 मिनट में करना है. This way you will not be wasting your time with your deep thoughts, daydreaming, or zoning out, and that works well. Now make sure you have someone to tell you about your timetable or accountability. Join a virtual library or a study partner or a community channel. For example, I had a clock and I used to a timer. I used to start at the moment I'm studying. And even if I am thinking about something that is not related to my study, I would pause that timer. The moment your hand will go to pause that timer, you will feel a sense of guilt कि oh shit, अब मैं time को रोकूंगी, and you will be more accountable. So anything can be your accountability check, but it's you who needs to decide कैसे करना है. Now this is our community channel and this is how we go about. We have mind maps. We have the timer with here with us. Everybody setting their timer कि वो दिन में कितना पढ़ रहे हैं. We have questions that they ask and we tend to answer all your doubts. Then we have support and guidance anytime you're feeling that you're not able to do something or you are finding it difficult yourself. I tend to be very active and I tend to answer everything, and if through voice notes or through text messages. And then we have monthly sessions also, video sessions where we tend to ask you questions and answer your doubts. This is some of the snapshots of the long mentorship that we do. Again, their daily targets. Somebody has sent their daily targets of the day, that this is all that they need to do and when they wake up and what all they need to do. Again, a timer of how much hours they have done. This is your score that they sent, and they tell me that what all they have done at the day. So that's all from my side. A big thank you to all of you for being patient and listening to me. And I hope this was a good session. And now you can ask your questions and your queries. I'll be happy to help.
So we have a couple of questions in the chat box. We'll start from there, and if somebody have any question, feel free to unmute yourself and ask.
Yeah. How to do PY topic wise per See, for PYQs, there is a simple rule. Just complete your subject, go to the PYQ section and do it subject wise. Do not do it topic wise. Because when you tend to do it topic wise, you tend to waste a lot of time. So for PYQs, stick to subject wise. See, that is what I tell you. How to complete any subject. I read some topics, one subject, some. That is what you need to have an accountability on yourself. If you keep doing juggling between a subject, you will never work, you will never improve in that subject, and no matter what content you are doing, you will fall short. For that, please keep a timer, check that 7 minutes per page, and that is how it works. Yes, please use all tag while solving subject wise as well as mixed bag question. Otherwise, you will not improve your MCQ solving skill. Not even clinical. Please use all tags. Yes, yes, yes. See, I was able to do it in 1 month from 21K to 3K. Even if it's a hectic posting, I think you start studying from today and give 5 to 6 hours every day till the end of your exam. It is very much possible.
There is one question that how many subject read in one day? Two, three, or only one?
See, I would suggest it's either one subject or two subjects in a day. If you're going for one subject, that's great. But if you want two subjects, please keep two subjects, like one is a long subject and the other is a short subject, so that it's easy for you to complete. If you do two subjects and that are long, I think you will not be able to complete any. See, if your GT score is less than 100, that means you still need to work on your content. For you to decide what is weak, if your GT score is more than 120, that means you need to work more on your revisions. If your score is less than 120, that means you need to work more on your content right now. You haven't read your notes well. If
Yeah,
you're
one thing I want to add here, like someone has asked regarding that how much subject to read in one day. So
Hanji.
like you told Sukhan that according to you, you need to read one and long and one short. But what I used to do during my preparation day, I'll just share with you. I
Yeah.
just divided the first year subjects and the second year subjects in the two parts. I used to read core subjects in a day. What I used to do, I just made first year subjects in the morning, and in the evening when I used to go for sleep, just before the 2 hours, what I used to do, I just divided the that micro and that pharmac part divided into, like, I used to read 4 and 5 bacteria in a one day, or 4 or 5 from the parasitology from one day. So what I felt that after completing those parts in just 1 or 2 weeks, I'll get more weeks to revise those again and again. So my first year and the final year, sorry, second year subjects are in a daily mode of revision. And in the afternoon, what I used to do, I used to read the long subjects. So it's
Hmm.
helped me a lot, because the first year and second year subjects give us lot of marks and lot of confidence to move for the long subjects. So what I used to do these things. So I hope it may help other people also.
Yeah, similarly, I told you that do pharma every day and do SPM every day. So that's two subject already, and one long and one short, or like sir said, one first year and one second year. So it's total of four only. But you are actually working on two subjects, and those two subjects that is doing 1 hour, like micro sir said, you don't even feel like that you're doing a subject. You feel like you are doing a topic, and you don't even realize once it's how is it done,
Yeah.
and it's done in 2 weeks. That is, yeah, that is how I did. So it was actually four, but it felt like two, and there was one in the morning. At night felt like you are doing a topic. Exactly same. uh then
Coming back to yeah, coming back to this question that how to do group study by WhatsApp, Telegram, Zoom, or Gmeet. So there is a space called virtual library, which all the community members or the long mentees do together. Is that for it is for all the early riser or late seaters. You can just join there because there are a couple of people always be there, keeping their camera on and off based on uh, like whatever suits them, and they study together. So you have to be on
लिंक
mute
कहाँ पे
and
मिलेगा?
study. Uh, I just ping me there. I'll add you into that group. Even if you are part of Sukhanpuneet community, it's shared there. But आपको share कर देंगे. आप बस एक बार ping कर देना. We'll share you that. And there is another question for you, sir, that how to complete any subject. I read some topic, one subject, some topic, other subject and subtopic, and how to stick to one subject.
yes, ma'am, I answered that
Uh,
question. That please set a target of 7 minutes for every page.
Sukhi.
When you do that, you are more accountable and you tend to read it quickly, and that is how you stick. And or you can have an accountability on yourself, or tell someone, or read with someone, or study with someone in a virtual library, or find a study partner. That also helps. Or
Even
if a
having your mentor really helps that because you have somebody to go and give answers to every day. So,
or you can start with doing 50 questions of that topic and read those 50 topics. What will happen is indirectly you are reading the entire subject, but आपको लगेगा नहीं आप कर रहे हो. So वो retrograde approach helps. If you are finding something that you're not able to read it, no matter what you're doing, please do retrogradely. 50 questions, 50 topics. 50 questions, 50 topics. This way you'll able to complete your subject.
I think so. There are lots of questions around medicine, how to approach medicine and how to integrate RR, BTR, and what is the right sequence. So, if you can just cover that.
See, for medicine, I think you don't need to do a lot of things. For medicine, please work on your basics first. Your physio, patho, pharma should be strong, and then medicine is just 30 or 20%. I think the core comes from patho and pharma. If that subject is strong, you are good to go. So please stick to RR videos of Preeti ma'am or Maro mein, Ela ma'am's videos. They are great. And then if you have BTR, stick to integrated part of BTR. You don't need anything else. But if you still feel that you're not able to do, then please go for RR videos of Marwaha sir. They're more than enough. You do not need main notes video. You don't even need RR videos. For example, mine was a morning batch and it had difficult medicine. But I had all correct question, I think, except one in medicine. And that's great score, I believe, in medicine because it's a difficult subject. ऐसी लिमिटेड करो, बट वो इतने अच्छे से करो that no matter what question comes from that, you can answer it. At times there will be question where you do not know the answer, but you will know that these are not the answers. उसके लिए आपको लिमिटेड कंटेंट करना है, लेकिन अच्छे से करना है. सो फॉर मेडिसिन, पैथो फार्मा पहले अच्छे से करो, फिर इंटीग्रेटेड मेडिसिन करो बीटीआर से, एंड देन सॉल्व क्वेश्चन. अगर तब भी लगे वीक है, फिर आरआर करो. प्लीज डू नॉट मूव टू सी. हम छोटे थे तो पहले एबीसी करते थे, फिर सेंटेंसेस करते थे ना. Similarly, please do a content that is concise in the beginning and then do something that's more. क्योंकि अगर आपसे आपका इससे काम हो रहा है and you have already done medicine your fourth prof, you already know your concepts. Only in the areas where it's weak, उस पे आरआर पे जाओ. That is how medicine has to be done. Just do limited content, but do lot of questions with clinical tags.
I think,
Anything else?
yeah, I think so. Let's talk on this, that how to deal with anxiety, be it the anxiety of we have lot on our plate, how to complete our timetable, or be it how to deal with GT score, the fear of not remembering while we are sitting for exam, because we have received lots of questions around how to basically deal with FOMO and anxiety.
See, first of all, you need to realize that every one of us sitting here and giving the exam has 24 hours. It depends upon you how you utilize those 24 hours. No matter how your day was, how your previous day was. कल कैसा भी हो कोई बात नहीं. You would have 24 hours today. You can either use those 24 hours to do something great और अपने backlog को complete करो, और you keep sitting और ये सोचो कि मैं तो कर ही नहीं पाया, मैंने तो वो भी खराब कर दिया. आप कल का दिन तो वेस्ट कर ही रहे हो, आप सोच के आज का दिन भी वेस्ट कर रहे हो. So put your thoughts to action first thing. Secondly, your anxiety will go away with the very first thing. अपना दिन plan करो. Once your day is planned, I think half of your work is done. So first planning. दूसरी चीज, I know बहुत sources है, बहुत apps है, बहुत कुछ है, and FOMO होता है. Please stick to yourself what you're doing. Find your mentor, find your guide, and उनसे बात करो. I see your mentor, your guide, even if it's a paid thing, उनका भी तो at the end of the day they also want कि हमारे बच्चे का अच्छा रिजल्ट आए ना. So they'll be giving their 100% to you, right? They will not keep things to us themselves and not tell you, and वो आपको वो सही बताएंगे. Just stick to your mentor and your guide. दूसरा, I think when you find that कुछ सही नहीं हो रहा, I think the treatment of choice is talking to your parents. Nothing in the world is as good as your parents, है ना. तो वो आपको, और जो वो कॉन्फिडेंस आप इंस्टिल करते हैं ना, वो तो हम में से भी कोई नहीं कर सकता, because they believe in you when nobody else in the world is believing in you. And sometimes just a spark of someone believing in you ignites everything in you and you feel like हाँ मुझे इनके लिए करना है, right? So पहला अपना दिल प्लान करो. दूसरा, trust yourself, talk to your parents, give time to your parents, find a mentor or a guide, and then do very limited things. The less you do, the better you score. एंड देखो, एंजाइटी ना सबको होती है, बट आप पे डिपेंड करता है आप कितनी एंजाइटी को अपने ऊपर अपने आप को सप्रेस करने देते हो. आइदर यू सप्रेस योर एंजाइटी एंड यू वर्क फॉर योर ड्रीम्स, और लेट द एंजाइटी सप्रेस यू एंड यू मूव फर्दर अवे फ्रॉम योर ड्रीम्स. Everybody has gone through this phase and everybody has come out. और ये भी तो सोचो ना, you all have been toppers throughout. अगर अब तक यहाँ पहुंच के हैं तो आगे भी पहुंच जाएंगे. And every time God has been with us, तो आगे क्यों नहीं होगा. So please trust the process कि मैं वो बच्चा था, जब बच्ची थी जो शुरू से टॉपर थी, अच्छा करती थी. I've reached here. You have done MBBS. It's not an easy task. अगर यहाँ तक पहुंचे हो तो फिर पीजी तो कुछ है ही नहीं. And once you reach residency, you realize कि अच्छा असली काम तो ये है. It feels like this, but once the exam is done, you feel like बहुत अच्छा फेज था, बस बैठ के पढ़ना ही तो है. So बैठ के बस पढ़ना ही है, और उसको कम पढ़ो लेकिन अच्छे से पढ़ो, और कुछ नहीं करना. प्रॉब्लम तब आती है जब आप पढ़ते बहुत कुछ हो, आप पढ़ते भी नहीं हो, आप वीडियोस देखते हो, यहाँ से भी ये भी कर लूं, मैं ये भी कर सकता हूँ, मैं इसको भी फॉलो कर लूं. Please stick to one source and do things. See, amalgamation works in this content, but please do not do amalgamation in the strategy. Then you will not reach anywhere. I think that's how. I think then sir can also tell us better on this,
And
because
on one thing, I will tell you all is that जितनी ये एंजाइटी आती है ना, ये इनएक्शन की वजह से आती है. जस्ट ऑलवेज
Right.
ऑब्जर्व योर पैटर्न कि अगर आप काम कर रहे होगे ना तब आपको एंजाइटी नहीं आएगी, बट व्हेन यू विल स्टार्ट थिंकिंग कि किसी वजह से आप काम नहीं कर रहे हो, देन यू विल स्टार्ट थिंकिंग कि वो भी बचा है, वो भी बचा है, वो भी बचा है, मैं नहीं कर पा रहा हूँ, एंड दैट विल ब्रिंग योर एंजाइटी इनटू द पिक्चर.
Right. Right.
And that I just watched somewhere, I don't remember, but that stuck with me how to deal with anxiety when we are working. So, the essence of that thing was that suppose you have 100 rupees in your hand, and that 100 rupees is your time, and तुमने उसके 50 रुपए खो दिए. So, will you just go away and throw the remaining 550 rupees is in your hand, or you will use that 50 rupees? दैट इज एग्जैक्टली हाउ वी हैव टू यूज टाइम. अगर आधा दिन निकल गया तो क्या हो गया, आधे दिन तो बचे हैं ना, उसको क्यों खराब कर रहे हो? वाई डू यू वांट टू थ्रो योर 50 rupees or 60 rupees that is remaining in your hand?
Mm.
You can still utilize that 60 rupees. 40 रुपए गए तो गए, कोई बात नहीं.
वो
So
हमारी
just
आदत होती है ना, जो हमारे पास नहीं होता उसके लिए रोते हैं, जो है उसको हम भूल जाते हैं.
Exactly.
भूल जाओ. तो इट्स ओके, इतना डिफिकल्ट मत हो खुद पे. इट्स जस्ट एन एग्जाम. तो just treat it as an exam. अपना मतलब like NEET PG is important, but it's not everything. तो
ऑल्सो अगर वेस्ट भी हुआ है तो नेक्स्ट डे 12 की जगह 14 घंटे पढ़ लो ना. आवर्स को यूटिलाइज करो, जो वेस्ट किया उसको नेक्स्ट डे दूसरे से बेटर करो. सी टॉपर्स आर नॉट बिल्ट इन अ डे, बट इट्स व्हाट यू डू व्हेन एवरीबॉडी एल्स इज स्लीपिंग. तो उस चीज को यूटिलाइज करना सीखो.
लेकिन जब नहीं हो रहा है तो सी डोंट just be very 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 honest with yourself, because it's okay to be light with others but very honest with yourself. Be very critical judge of yourself and see ki are you counting your activity as your uh, busy thing, or do you really doing the act. तो जो तुमने प्लान किया है तुम सच में कर रहे हो, दैट इज व्हाट प्रोग्रेस इज गेटिंग काउंटेड एज. ये नहीं कि मैं 4 चीज एक्टिविटी कर रही हूँ. एक्टिविटी इज नेवर अ प्रोग्रेस. तो बी वेरी वाइज विथ व्हाट यू आर एग्जैक्टली डिलीवरिंग. जो तुमने सोचा था कि मैं 50 या 100 क्वेश्चंस करूंगे, वाज आई एबल टू डू इट, और जस्ट फॉर सेक ऑफ इट मैंने क्वेश्चंस कर दिया, या फिर मैंने माइंडफुली बैठ के किया है. सो व्हाट यू आर डूइंग माइंडफुली दैट इज गेटिंग काउंटेड एज अ प्रोग्रेस. तो फॉर सेक ऑफ इट चीजें करना छोड़ दो. दैट विल नॉट टेक यू एनीवेयर.
And I think in this world of social media and being aesthetic, most of the time we are just decorating our room to look at aesthetic, to post a photo that yes I'm studying. अगर आप सच में पढ़ रहे हो ना, it doesn't matter आपका रूम कितना aesthetic है कितना नहीं, and you don't need to show it to the world. Please work in silence and let your result speak for yourself. आप इन सब चीजों से ना दूर हो जाओ, because then you are wasting a lot of time on social media. जितना इन चीजों से दूर होगे तो better you will score. See, some things work like the OG way only. You cannot see that we are Gen Zs and that is how we work. I don't think that way, because hard work is important and it has to be done it in a strict way.
खुद के साथ तो बहुत स्ट्रिक्ट हो. आई ऑलवेज टेल एवरीबडी कि तुम दूसरों के साथ लीनियंट हो जाओ, कोई प्रॉब्लम नहीं है. लाइक जस्ट बी वेरी 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 क्रिटिकल जज ऑफ योरसेल्फ.
Exactly, because you're going to decide your next 40 years.
You are going to marry somebody, your branch or your the college you are going to be in.
Exactly.
I think
Also,
Henry have one question. Shall we use all tags always while solving subject-wise CM and mixed bag, or any fixed tags to create a clinical custom?
yes, you have to use all tags while solving custom module, because then that removes the bias. Because once you have a bias of a tag, I think you are already limiting yourself to the questions that are being asked. And see, in NEET PG, they are not going to ask you question from your BTR notes or your marrow notes. See, when you're doing a question from marrow notes and then you're doing GT, you find things that are similar to your notes, right? Once you're doing BTR and then doing question that Zena ma'am asked, you know that अच्छा ये notes में ऐसा लिखा था, मैम ने ये पूछा है. But NEET PG guys are not going to ask you from any of these. They will ask you question from the patient that is coming to you, and patient do not come with selective tags. They have all tags, right? So please do question with all tags. Also,
There is
somebody's asking question
how
of
to
how to
complete all.
subscribe for community channel and for community channel and all. See, Asta ma'am is there. You just need to DM her and we'll send you the link to you to join, and it is still NEET PG, and the rest Asta ma'am can tell you better.
Yeah, and how there's a question from Arpita that how to complete all PYQs if we are just doing mixed question. There are so many PYQs and how to complete them. There's no need to complete, Arpita, everything, first of all.
Yeah, and secondly, the questions that you're doing as custom module, they're in the morning and at night. The PYQ has to be done after the subject is complete. And in my timetable that I tell and I give to students, I give a stipulated amount of time for the PYQs. So please do not worry. PYQs have to be done and they need to give you need to give selective time for that. Please give complete half day to PYQs, okay?
How to do custom module different from QBank? I thought when you do custom module, the question are picked from QBanks. There are so many questions on QBank and PYQs.
Do not, just give me a second.
Yeah, just read it. It's from Nivedita. Nivetha. I'm so sorry. Satyam, on your question that your score is stuck between 120 to 130.
I've
For
answered both of these questions already.
Yeah, so I think just to understand that why your question is why your score is stuck, we first need to talk and see that how you are approaching exam, because everybody have a different way of making mistakes. Somebody just do lots of silly mistake, and that for me, silly mistake is the most a horrible mistake you are making, because that is the mistake you are making a habit of making that mistake. So we need to first talk and just figure it out, just see your last 4 GTs to figure it out what kind of mistake you are making, and then only we'll able to figure it out कि problem क्या है. It's just like कि डॉक्टर को पहले पेशेंट को देखना तो पड़ेगा ना, और टेस्ट करा के कि प्रॉब्लम क्या हो रही है, रिपोर्ट्स क्या आ रहे हैं, then only the prescription will be given. So similarly we need to see your last 4 GT where the problem is, and then only Sukh will able to help you out कि stuck कहाँ हो रहा है और उसको resolve कैसे करना है.
Yeah, absolutely right.
I think so many questions on custom module and QBank.
I think, see, as you go with us in this journey, your questions will be solved because you tend to ask. See, this is a thing. We tend to ask more of questions and do less work. Please start doing custom module. Once you start doing it and then you face problem and then you think कि मुझे देखो आप ना 18,000 questions नहीं कर सकते. There are 18,000 questions on Marrow. You cannot do it. For example, you are doing 50 questions in the morning and 50 questions at night. So you're doing 100 questions every day.
डॉक्टर सुखनप्रीत, मेरा एक क्वेश्चन है कि जैसे आप बोल रहे हैं मिक्स क्वेश्चन करना, मिक्स बैच सुबह उठते ही, तो जितने बहुत सारे आई थिंक 222 हैं पीवाईक्यू के मॉड्यूल, तो वो कैसे कंप्लीट होंगे? वो भी एक बहुत बड़ा है मतलब.
हाँ जी, वो हमने अभी बताया कि उसके लिए आपको अपना टाइम टेबल जब बनाते हो, फॉर एग्जाम्पल यू गिविंग 3 days टू फॉर एग्जाम्पल लेट्स से माइक्रो, तो सेकेंड 2.5 days आप पढ़ने में दो, हाफ डे आप सिर्फ क्वेश्चंस पीवाईक्यू एंड एसडब्ल्यूटी के लिए छोड़ो. यू नीड पीवाईक्यूज भी पार्ट ऑफ सिलेबस है. आप नोट्स को सिलेबस मत समझो, पीवाईक्यूज को भी सिलेबस समझो, बिकॉज इट्स योर चेकलिस्ट कि मुझे ये भी करना है. फॉर दैट अपने टाइम टेबल में ही ऐसा बनाओ कि हाँ मुझे इतना टाइम अपने नोट्स पढ़ने में लगेगा और इतना टाइम पीवाईक्यूज करने में लगेगा. व्हेन वी टेंड टू डू टॉपिक वाइज, आई थिंक हम ना खत्म ही नहीं कर पाते. स्टार्टिंग में तो बड़े जोश से करते हैं, बट देन वी डू नॉट डू देम. उसको आधा दिन दो एंड हाफ डे इज मोर देन इनफ. मैंने सारे पीवाईक्यूज एंड में फॉर ऑल सब्जेक्ट्स स्टार्टिंग फ्रॉम 2017 टू 2023 लास्ट डे पढ़े थे इन 2 hours ऑफ ऑल सब्जेक्ट, एंड दैट्स वेरी मच पॉसिबल. तो करने भी पॉसिबल है. थिंग इज आप लोग ना करके देखो. द मोर व्हेन यू ट्राई थिंग्स ओनली देन इट वर्क्स आउट.
कितनी बार करना चाहिए पीवाईक्यू? मतलब 2 बार 3 बार?
do question every time you have to do PYQs. PYQs तो चेकलिस्ट है ना, उसको तो जितनी बार करोगे. See, we need to ensure कि अगर PYQ से कुछ आ गया वो गलत नहीं होना चाहिए. That is a bank question. And उसको जितने अच्छे से करो, जितनी बार करो, so that there's a reflex. And secondly, अगर वो PYQ twisted आया, आपको वो भी पता होना चाहिए, और वो तभी होगा जब आपको question भी याद होगा. So every time you do a subject, every time you have to do PYQ.
आपने कितने बार किए थे मैडम?
I had done a division of 7 to 8 times, so 7 to 8 time PYQs.
I think there is one question on active recall, like what is the right way to do active recall? This you can answer.
Yeah, for active recall, as discussed in the session, you will first try to do it before starting a subject. जब सब्जेक्ट करना शुरू है ना, उससे पहले करो. बुक खोलो, फर्स्ट पेज को पढ़ो, whatever you remember, just try to recall in your mind. अगर वो नहीं होता, take a page, write down everything that you remember. ये भी नहीं कर सकते, you have unannotated PDFs or BTR. Write everything that you remember that ma'am has given you. These are 3 ways of doing active recall. And then open your notes. You will find your lacunae. These are your volatile areas. And now you can write those topics in your volatile copy or your छोटी copy. दिस इज हाउ यू विल फाइंड कि आपका वॉलेटाइल क्या है. जो आपके जीटी में गलत हो रहा है वो वॉलेटाइल है. जो आप एक्टिव रिकॉल में मिस कर रहे हो वो आपके वॉलेटाइल टॉपिक्स है, वो आपके लैक्यूने है. दैट इज हाउ एक्टिव रिकॉल हैज टू बी डन.
एक चीज और ऐड करना, जैसे कि अभी पूछा कि मैम आपने कितनी बार किया, तो मेरा ये कहना है कि मैम ने क्या क्या किया वो मैटर करता है. ये मैटर नहीं करता है कि मैम ने कितनी बार किया, क्योंकि सबकी अपनी खुद की एफिशिएंसी होती है. कोई 10 बार करके याद कर पाता है, कोई एक बार में ही, उसके लिए एक बार पढ़ा उसके लिए वो रिवीजन भी वही हो गया. तो ट्राई टू फोकस ऑन व्हाट कंटेंट यू गोना रीड एंड हाउ यू गोना प्लान फॉर दैट कंटेंट, अपार्ट फ्रॉम जस्ट आस्किंग कि मैम आपने कितनी बार किया और वही सेम आप फॉलो करने के चक्कर में आप अपना रूटीन खराब कर लो. तो बस कंटेंट और उसको प्लान कैसे करना है वो प्लान करो, ये नहीं कि कितनी बार पढ़ा है.
नहीं सर, वैसा नहीं है. मतलब कोरिलेट कर सकते हैं मैम की 11,000 रैंक से 2,000 3,000 में, तो बड़ा मैम ने एक सुधार किया है.
वो मैं समझ गया. वो एक क्यूरियोसिटी हो जाती है कि हमें जानना है कि मैम ने कितनी बार किया है. लेकिन मैं अपने पर्सनल एक्सपीरियंस से बता रहा हूँ कि कोई हो सकता है कि उसको 10 बार करना पड़े, कोई हो सकता है 2 बार में ही कर ले, कोई 5 बार में ही कर ले. तो वो तुमको खुद को पता है. तुमको अगर कॉन्फिडेंस आ रहा है, तुम्हारे क्वेश्चन सॉल्व होने अगर 3 रिवीजन के बाद ही चालू हो गए, तो ये अच्छा है ना कि तुमको 7 बार पहुंचना जरूरी नहीं है. अगर तुम 4 बार में ही अगर तुम अच्छा मार्क्स लाने लग गए तो.
And it's the 7 times is just for a possibility कि yes there are people जिसने 7 बार रिविजन किया है. तो अगर कोई 2 के बाद बोलता है यार पॉसिबल नहीं है, 2 से ज्यादा रिविजन कैसे होगा, so there is a possibility if you can think.
तो हमारे केस में तो एग्जाम केप्ट पोस्टपोनिंग एंड वी वर एबल टू डू मल्टीपल रिविजन्स. इट्स नॉट पॉसिबल फॉर एवरीवन टू डू 7 रिविजन्स बिकॉज़ इतनी बार तो पोस्टपोन नहीं होगा ना.
क्या पता, nobody knows 2025 में क्या होने वाला है. तो क्या there is one question that I did pharma Garg sir RR should now start doing main notes.
No, if you've done from RR, please do more questions from pharma. Do not change your notes at this point. Rather do a lot of questions. I think it will work.
If I'm starting to give GTs now, how frequently should I be giving from now on, and how should I increase the frequency?
See, as discussed, if in the starting it has to be after every 15 days and for 1 month, then after every 10 days, then move on for 1 month. It is each for 1 month, right? And then move on to every 7 days. And then you can use approach of doing a GT and then revising the subject. Then it's on you that you do it every 4th day or every 3rd day. But start with 15 days for a month and then 10 days.
So there's a question how to review the GT after giving it. It's very hectic to do. What to add from GT question?
I think that's a very, very long question and it's difficult for us to discuss here. But if you join with us on our community channel, we'll be reviewing the GT along with you, and that will help you because it's a very personalized approach for every student and depends how much you are scoring, right? So GT reviewing is very personal, I feel. And if you're there with us, we'll be happy to help you.
And just to sum it up for you, Shivam, that just whenever you are writing GT, just try to bucket all the questions during review that what kind of mistake you have made there. Was it a recall error? Was it a concept error? Or is it a silly mistake? When you'll give the tag to each and every question, you will able to identify that what percentage is the silly mistake, and that is the blunder mistake you are doing. Trust me. And then if there's a concept error, तो आपको वापस जाके वो concept ही सीखनी है. And if it's a recall error, then you know that after multiple revisions, you are going to pick it up and उसको bookmark करके आप revise कर सकते हो. But then this is the general on and all everybody should do. इसके आगे आपके क्या problems हो रहे हैं या फिर there is some specific kind of pattern which you are doing आपके 2-3 GT देखने के बाद your mentor will able to help you out. Yeah, somebody have raised hand.
एक question बहुत important है. महिमा शर्मा ने पूछा हुआ है, after every 3-4 GT, I attempt same topic wrong again, which I did previously, and the cycle continues. How to cope up with this forget revision, forget cycle? This happened with everyone. So what your say on Sukh this?
I think वो इसलिए because 3-4 months बाद हम चीज भूल जाते हैं ना उसको 3-4 weeks के बाद, तो वो आपकी just short term memory है. Again आप revise करो, वो क्या होता है कि आपकी short term memory long term में बनती जाती है. पहले वो आपको 1 मंथ में भूलना शुरू करोगे, फिर इट विल बी लाइक कि 2 मंथ्स के बाद मैं भूल रही हूँ। सो इट हैपेंस। तो उसके लिए बस कुछ नहीं करना, मल्टीपल रिविजन्स करनी है। देयर इज अ सिंपल सी नीट पीजी ने एक बहुत सिंपल स्ट्रैटेजी है, मल्टीपल रिविजन्स। द गेम स्टार्ट्स एंड एंड्स देयर। कीप ऑन रिवाइजिंग। भूलोगे आप लास्ट डे तक भूलोगे, बट बिलीव मी एग्जाम में सब याद आएगा। बस जो भूल रहे हो उसको अभी पढ़ो, फिर क्या हो गया अगर भूल गए हो, अभी पढ़ लो उसको, अभी टाइम है, कोई चेक थोड़ा कर रहा है। जीटी स्कोर आपको कुछ डिसाइड थोड़ा कर रहे हैं, नोबडी इज गोइंग टू आस्क योर जीटी स्कोर आफ्टर एग्जाम। नो मैटर कितना अच्छा है, नो मैटर कितना बुरा है, रैंक आ गया, दैट्स ऑल। सो फॉर दैट सिंपल सी बात है, मल्टीपल रिविजन्स करते रहो। आई थिंक दैट्स ऑल फ्रॉम माय साइड। सर आप बताना चाहोगे कुछ?
मैं इंटर्नशिप के समय क्या करता था कि मान लो सुबह मैंने कोई टॉपिक पढ़ा और मैं पोस्टिंग में गया हुआ हूँ, तो मैं 2-3 ना A4 साइज पेपर जेब में लेके घूमता था। जैसे ही टाइम मिला ना, आई यूज टू स्टार्ट राइटिंग ड्यूरिंग माई पोस्टिंग डेज कि यार मैंने आज क्या पढ़ा है, या 2-3 दिन पहले क्या जो भी उस टॉपिक के बारे में रिकॉल कर पाता था मैं वो लिखता था। तो इट्स बेटर, वो ये बहुत हेल्प करता है और ये लॉन्ग टर्म मेमोरी में चला जाता है। तो आई थिंक इफ यू कैन ट्राई दिस इट विल हेल्प यू।
And
और
even
ये आएगा कि ये आपका वॉलेटाइल टॉपिक है, तो आपको जो समझ नहीं आता छोटी कॉपी में क्या लिखना है, वो यही चीज है दैट यू कीप फॉरगेटिंग आफ्टर एवरी फिक्स टाइम, तो उसको लिखना होता है छोटी कॉपी में।
in the question जो आप बुकमार्क कर रहे हो, be it your GT के questions या फिर PYQs के question, keep revising it, keep every week आप अपने लिए half an hour निकालो, या फिर every day just make a like promise that you will revise 5 questions every day. और जैसे जैसे वो आपके बुकमार्क क्वेश्चन ना आफ्टर अ मंथ और 2 आपको लग रहा है कि मेरे को ये कंसेप्ट के क्वेश्चंस तो गलत नहीं हो रहा, तो उसको मतलब अनबुकमार्क करते जाओ, सो दैट तुम्हारे बुकमार्क्स के नंबर ऑफ क्वेश्चंस भी कम होते जाएंगे। तो 4-5 क्वेश्चंस तो तुम डेली का रिवीजन कर ही लो, जस्ट सी एंड देन सी कि हाउ यू आर इंप्रूविंग इन दैट कंसेप्ट। और उस क्वेश्चन को याद नहीं करना है, क्वेश्चन रिवीजन का मतलब क्वेश्चन को याद नहीं करना है। द वे सुख सेड कि तुमको ईच एंड एवरी ऑप्शन को देख के एलिमिनेट करना है, दैट विद द प्रॉपर लॉजिक एंड रीजन की क्यों गलत था ये। बिकॉज द पर्पस ऑफ 5 क्वेश्चन रिविजन इज टू अंडरस्टैंड द कोर एंड द कंसेप्ट बिहाइंड दैट टॉपिक, नॉट कि ये क्वेश्चन मेरा गलत हुआ था।
एक और क्वेश्चन है, ये बहुत कॉमन क्वेश्चन है जो सब लोग पूछते हैं हमेशा। इफ समवन हैव नॉट स्टडीड टिल नाउ प्रॉपर्ली, इज इट स्टिल पॉसिबल टू गेट अ डिसेंट रैंक if we best utilize the time from now?
See, the very simple answer is there in front of you. If I could do it in 1 month, everybody can do it at any time given. करना क्या है बस, see, in that 1 month I went crazy. The answer is simple. I studied for 18 hours, but मैंने वो 1 month में किया. You have 5 months. Study decently. It's very much possible. NEET PG is just revision and MCQs. Content भी ना back seat ले लेता है after some time. It's just revision and how much you do, how well you do your revisions and अपने skill, अपने MCQ solving skill. कुछ मत करो, एक क्वेश्चन है उसमें 4 ऑप्शन है, एक टॉपिक से 4 टॉपिक्स पढ़ो, दैट इज हाउ, दैट्स मतलब 10 क्वेश्चन कर रहे हो ना, एट द एंड आप 40 टॉपिक रिवाइज कर चुके होने चाहिए। वंस यू आर डन विद 10 क्वेश्चन आपको लगना चाहिए कि हाँ मेरे 40 टॉपिक्स हो गए, नॉट दैट मेरे 10 टॉपिक्स हुए। दैट इज इट। प्लीज टाइम डिसाइड नहीं करता कि आप कर सकते हो, इट इज योर कैपेबिलिटीज। और जब एग्जाम हो जाएगा ना, आपको पता भी नहीं होगा कि अच्छा मेरे में इतना कैलिबर था, एंड देन यू रियलाइज यार मैं इससे ऊपर टारगेट सेट कर लेती, क्या पता इससे भी बेटर कर लेती। तो प्लीज डू नॉट लिमिट योर सेल्फ इन अ बॉक्स, जस्ट अपने आप को अपने लिए पढ़ो। सी व्हेन यू आर इन योर रेजिडेंसी, आप पेशेंट्स के लिए कितना करते हैं, यू वर्क 36 आवर्स 38 आवर्स, और उनसे तो आप रिलेटेड भी नहीं हो ना, दे आर नॉट इवन योर रिलेटिव्स, दे आर नॉट इवन योर क्लोज फ्रेंड्स, यू डोंट इवन नो देम, बट यू गो ऑल आउट एंड इन फॉर देम। बट ये 5 मंथ्स तो आपके अपने है ना, तो अपने लिए क्यों नहीं ऑल आउट एंड जाती, तो अपने लिए सब कुछ करके देखो ना। सो इन दीज 5 मंथ्स फॉरगेट एवरीथिंग एंड गिव दोस 5 मंथ्स टू योरसेल्फ। दुनिया में क्या चल रहा है, आपके घर पे क्या चल रहा है, दुनिया में चाहे अर्थक्वेक सुनामीज क्या आ रहा है, भूल जाओ, ये अपने लिए 5 मंथ्स है। दैट इज हाउ आई वर्कड इन दैट 1 month and you will see a marvelous rank, and that's सच्ची में possible है। So I'm telling you, and it's really really possible for all
And
of you.
and all of you are doctors, मतलब आपकी community में it's very known that how much effort all of you guys can put in. I don't know कि किसी और stream में इतना होता भी है, because recently I was talking to one of the mentor, वो मंडे से घर नहीं आई है। आई एम टॉकिंग अबाउट लास्ट मंडे, शी हैज जॉइंड रिसेंटली अभी जनरल सर्जरी में, उसको मंडे से अभी तक घर आने का टाइम नहीं मिला है। सो यू आर द पीपल हु पुट दैट मच एफर्ट टू लाइक हेल्प अदर्स, तो अपने लिए तो आप इतना एफर्ट डाल ही सकते हो ना। एंड यू हैव द
प्रॉब्लम
कैपेबिलिटी। मतलब ऐसे 48 घंटे काम कर सकते हो आप लोग, ये तो पढ़ाई करनी है तो 4-5 महीने की बात है।
खुद के लिए प्रॉब्लम यही है, हम लोगों के लिए बहुत कुछ करते हैं लेकिन अपने आप को प्रायोरिटाइज नहीं करते। बस आप इन 5 months में प्रायोरिटाइज योर सेल्फ, सेट अ टारगेट ऑफ 8 hours every day, नॉट मोर देन दैट। 8 भी कर लो ना, इफेक्टिव 8, यू कैन डू ग्रेट।
व्हाट इज दिस
और
क्वेश्चन?
सुखनपुरी,
यस
डॉक्टर
कपिल।
डॉक्टर
नो
सुखनपुरी,
मैटर
मेरा
यू
एक
आर
क्वेश्चन
फ्रॉम
है कि
हाँ जी।
हाउ टू रीड एक्सप्लेनेशन ऑफ पीवाईक्यू एंड एक्सप्लेनेशन ऑफ जीटी क्वेश्चन। वी नो कि इतना सारा एक क्वेश्चन होता है, उसमें से 20 क्वेश्चन निकल के आते हैं, तो वो बोलते हैं कि 3 आवर में ही इसको रिव्यू करो, बट आई थिंक वो पॉसिबल नहीं हो पाता, कैसे करें उसको?
आई थिंक ये ना हम इन डिटेल डिस्कस कर सकते हैं, इट विल टेक लॉट ऑफ टाइम। आइदर वी कैन हैव अ पर्सनलाइज सेशन विद यू और यू कैन बी पार्ट ऑफ द
समराइज
कम्युनिटी।
समराइज वे में, डिटेल तो चलो अपन करेंगे, बट समराइज वे में।
समराइज आई थिंक ये ना बहुत पर्सनलाइज होता है, डिपेंडिंग वेयर यू आर एट दिस लेवल, हाउ मच यू आर स्कोरिंग इन जीटीज एंड आप कैसे रिवाइज करोगे। So it cannot be taught right now summarized. See, that can only be done once I know where you are right now, because वो ना different है, it's different for every student और हर किसी का पढ़ने का तरीका different है ना। the easiest answer I can tell you is question पढ़ो, option पढ़ो and then देखो कि ये option answer क्यों नहीं थी and then just go to the next question.
मतलब आस्क योर सेल्फ फर्स्ट कि ये तुमको क्यों लगता है ये आंसर नहीं था, एंड देन ओपन द एक्सप्लेनेशन एंड रीड, बिकॉज सारे
Yeah.
क्वेश्चन का एक्सप्लेनेशन पढ़ने की जरूरत भी नहीं है तुमको। जो तुमने सही किए हैं, जस्ट इफ यू आर एबल टू गिव लॉजिक कि चारों में से ये सही क्यों आंसर है एंड अदर 3 आर नॉट, तो उसके एक्सप्लेनेशन की ज्यादा जरूरत भी नहीं है। जस्ट रीड इट वंस एंड सी कि हाउ मच इट्स अलाइनिंग विथ योर। जिसमें गलत हुआ है उसमें यू हैव टू रीड एंड यू हैव टू अंडरस्टैंड कि कहाँ गलत हो रहा है। नाउ इट ऑल डिपेंड कि तुम्हारा कॉम्प्रिहेंशन कैसा है कपिल, and your comprehension will only be able to understand when she will talk to you. So वो तुम्हारी comprehension पे भी बहुत सारी चीजें break down होंगी। But in general तो यही होता है कि before reading any explanation just ask yourself कि what your mind says कि क्या क्यों नहीं हो सकता है, क्यों हो सकता है, and then you can just read the explanation. It's a general reading and comprehension for sure. What is this BTR2 or 1? I have used 1 before going to restart my preparation.
See, it's you can use either. Only that matters is please keep revising it again and again and do questions. It doesn't matter. The content remains almost same. Content ना 2 साल पुराना वाला भी उतना ही है जितना आज वाला है. It's a market at the end of the day, and everybody is making money and they need to give tags. So do not please think of कि 2 करे 1 करे ये करे वो करे. Just do whatever you're doing, but do it wholeheartedly. That is one answer. Put your all in, do it wholeheartedly, and it doesn't matter 2.0 1.0. अगर आपने 1.0 किया है, stick to 1.0. If you're doing 2.0, do not have the FOMO of doing 1.0. That's it.
See, there is no mandatory to solve Q banks, marrow Q banks and GTs. If one is following cerebellum, end of the day, see, GT is just a way to analyze yourself and see where you are standing. It doesn't matter कि तुम cerebellum का दे रहे हो, marrow का दे रहे हो. इतना इतना फोमो में नहीं पढ़ना है।
लाइफ को ना सिंपल रखो, सिंपल सिंपल करो एंड आ जाएगा, रैंक आ जाएगा।
No, she is saying कि if one is following the cerebellum, is it
Is it
necessary to
necessary to
solve
solve
Mario Cubic and GT?
GTs? Yeah, it's not.
No, if you're not having the app, stick to what you're doing. पर वो ऐप इतने अच्छे से करो कि हाँ, you know that you've done everything from there.
Vic, if it's bookmarking is working for you, go ahead with bookmark. Because there is no one solution going to fit everybody. If it's working for you, bookmarking, go with it. Okay, I
I
think
think
we are already like 30
answer a lot of
minutes.
questions.
Yeah, we are already 30 minutes ahead of time. So if you have any question, we already have a WhatsApp group. Put your questions there, and all the questions I will share with Sukh, and she will answer, and I'll post it there. And for the mentorship you all were asking, um, and the community, I'll share the link there. And coming back to the log mentorship she was talking about, I'll just briefly sum it up here. So every mentor is going to have 3 or 4 personal mentees with them. With mentor are going to be with that mentees till their NEET PG examination. They are going to hold their hand with their preparation, everything what is going on in their preparation, just like another pair of friend. And they will keep asking and helping them in their preparation. Every day they will be talking over chat, their daily planner schedule, whatever required for that particular person, the mentor will be there to hold their hand. But it's a very close space program because every mentor have a limited capacity to have mentees. So the people who have started residency, who have taken medicine and all, they are taking only one or two mentees. Sukhanpuneet have five, and sorry, that spot is already before booked. That's the reason she had started the community. That is where she is helping more number of people. But if you still need a mentorship, of long mentorship, feel free to reach out. There are a couple of new amazing mentors have joined. You can take long mentorship with them. But yeah, to keep the quality in place, because this is your exam and we want quality at the par, because this is your life, and career in general is a very, very, very important thing. So we want every mentor to give you very personal and focused attention, and that's the reason long mentorship is a very close space program. तो उसमें बहुत spot की problem होती है कि starting में हर mentor दो spot open करता है and then वो निकल जाती है. So if somebody is interested, please feel free to reach out. There are a couple of new mentors have joined and they have opened their one or two spots. So you can check it out. And for Sukhanpuneet, community is open. And anytime if you want to talk, there 15, 30 and 15 minutes, 60-minute spot is open. You can book that time and you can talk to Sukh any point of time.
And in the community channel also, we provide free sessions every month. So we discuss that what you're going through, and we discuss your GTs as well. So we are there with you till the exam. The only thing we demand is that if we are giving 100%, please give your 120% in that. That is all. See, we are very passionate in helping you. All we need is your sincere efforts.
And there is a team sitting behind here who will listen to all your concerns and problem and try to schedule the sessions. If you ask for a session, everybody will trying to provide you sessions or connect you with your mentor for a one-on-one meeting. Everything will be planned for you, keeping you and your mentor's availability. So there's a team who's sitting and working very hard for you. So now it's your time to give your 100%, because it's you are giving so much. So now it's a small contribution from our end to help it for you. So just don't worry, just keep studying, ask for help wherever needed, please. Your dream deserves everything, so don't be ashamed of asking for help कि मैं तो सब कर लूंगा. It's good, सब कर लो अगर, but अगर कहीं भी जरूरत लग रही है तो ask for it.
And it's just an exam at the end of the day. Please इसको इतना भी लाइफ पे मत सवार करो कि मैं इसके बिना मैं कर नहीं पाऊंगा. There are a lot of options. See, अगर एक एग्जाम नहीं होगा, there will be a lot of other opportunities coming for you. One door closes and 10 other open. That is okay. अपना sincere effort दो. Result is not something that's in your hand. Sometimes things don't work out, and then some things work out that you don't have thought about also. ठीक है? तो इट्स ओके, आराम से करो, सब हो जाएगा, और जो होगा ना आपके अच्छे के लिए होगा. जस्ट ट्रस्ट गॉड इन दिस प्रोसेस.
I heard some quote like na कि when the door closes na then the windows open. So
एग्जैक्टली
always look for the windows. It's just not like that the doors are closed and you can't see through the window.
एग्जैक्टली जैसे सबको रेडियो करनी है, बट एट द एंड ऑफ द डे कई बार यू एंड अप इन अनदर ब्रांच एंड देन यू रियलाइज ओ दिस ब्रांच इज समथिंग मोर दैट हैज लॉट ऑफ इंटरेस्ट एंड आई कैन डू मच बेटर इन दिस ब्रांच. सो ऐसे ही ये एग्जाम है, आपको लगेगा कि ये एग्जाम सब कुछ है, बट ऐसा है नहीं.
4-5 महीने इतना 4-5 महीने का मत सोचो. टेक एवरी डे एज वन डे, एंड उस दिन का जो टारगेट सेट किया है, ट्राई टू कंप्लीट 60-70%, एंड एंड ऑफ द डे क्लैप फॉर योर सेल्फ कि मैंने आज अपना अच्छा किया. ज्यादा नहीं सोचना है कि 1 महीने बाद क्या होगा, 3 महीने बाद क्या होगा. रोज शाम में बैठो सोने से पहले एंड हैव अ 10 मिनट ऑफ इंट्रोस्पेक्शन टाइम एंड सी कि हाउ यू हैव स्पेंड योर डे, एंड बी वेरी ऑनेस्ट इन दैट 10 मिनट्स पीरियड, एंड जस्ट क्लैप फॉर योर सेल्फ कि मैंने अपना आज का दिन बहुत अच्छा किया यार. जस्ट बी प्राउड ऑन योर सेल्फ, द एफर्ट्स यू आर पुटिंग इन. हम अपने आप की तारीफ करना ही भूल जाते हैं. सो डू
बस
दैट.
वन इज द रूल in this prep. आज का टारगेट और खत्म. And when you are in this community channel, I think all of you will achieve your targets.
चलो,
So I in here, and I think
Thank
it was
you.
useful for you.
Yeah, if it is, please give a thumbs up.
Thank you.
Thank you all for joining in, and we will keep helping you all in best of our capacity. All the very best for your prep.
Thank you everyone. All the best.
Thank you everyone. Best of luck.
Bye bye. Good night.